Health Equity Fund. Now, this is something that each registered student is entitled to. I think it's around the $2,500 range for your entire career as a student for here at UC Davis. You can access that fund for really anything health related.
Welcome back to the UC Davis Aggies Talk Health podcast brought to you by UC Davis Student Health and Counseling Services. My name is Varsha and I'm joined by psychiatrist Dr. Liu. Thank you so much for being back here.
Varsha, it's a pleasure. Good to see you again.
Yeah, absolutely. So let's talk a little bit more about some barriers to mental health access for students. How do you think that lack of awareness or knowledge about mental health leads to undiagnosed mental illness?
Mental health, there's always been sort of a stigma to it. And I think we also live in a rather unique time where knowledge and awareness can be a little bit tricky, especially if you're trying to really access factual data here. I think ultimately what I'd encourage folks is that if you do have a concern, if you do have a question, our team is here available for you. Being here, I've had this amazing opportunity to work with just a tremendous team of psychiatry, of psychiatric nurse practitioners, as well as case manager that are here to really support you in your mental health care needs.
And what do you think are some common misconceptions that students might have about mental health and mental illness, and how do you think that might prevent them from coming to access your services?
One thing we sometimes do hear is that, sometimes students are a bit hesitant to access psychiatry because they say, I'm not ready for medications. That is a perfectly okay space to be in. We don't necessarily have to always be prescribing medications. Really, I think our role is to help support you in clarifying what may be going on and to collaborate with you to draw up a bit of a game plan on how to best move forward, which doesn't mean always including medications. It can include a rather broad range of really mental health care tools that hopefully can address your needs.
What are some tools that you have that might help students preserve some of the autonomy and dignity of being a part of what can be a stressful process in managing their mental health?
We certainly value autonomy. In the midst of stress, in the midst of distress, that lack of control can really feel overwhelming. One tool that we have to certainly support you along that process is to offer options. You're the captain of the ship. So, I'll lay out the options that I feel would benefit you. I certainly want to engage in a collaborative process with you to see how to best move forward. Even if it means let's just schedule a follow-up appointment in a couple weeks while we kind of think about things.
Yeah, and talking further about connecting students with psychiatric services, and I know you touched on this a little bit last episode, but how can a student make an appointment with you?
Really, there's two main paths to our service, which is a referral service. You can get a referral from our primary care providers here at Student Health and Wellness, and you can also get a referral to us from our counseling services partners, our therapists here on campus. And through both those paths, feel free, engage with them, and they'd be more than happy to help navigate you towards us.
And what should a student expect from an appointment with you?
We essentially have two types of appointments. We have an intake, and then we have follow-up appointments. And so with an intake, we're able to schedule intakes for an hour. And during that time, really, as I share with my students, this is really an opportunity for us to kind of get to know each other. I want to get to know you. Invariably, you'll get to know me. But really, I'm here to support you in any way I can.
And for a student that maybe has never visited a psychiatrist before, what are some questions that they should ask you?
Oftentimes, what I encourage folks to do is come in with your questions. And when I say that, I encourage folks to actually write things down. This is a public service announcement for any sort of kind of appointment with any, let's say, physician, therapist, or anything. Come on in. if you've had questions, I encourage you kind of write them down before you come on in. Because oftentimes, in the middle of an appointment, sometimes, we may not get to everything that's kind of on your list. But if we have them written down, I think those are nice prompts for us to really address as much as you like here during our appointment.
And besides the questions, are there anything else that students should maybe bring into an appointment, like documentation or past information about anything?
With documentation, we have a wonderful in-house medical records manager, and she often helps us when we need to gather documentations, let's say from prior providers, hospitalizations, emergency room visits. And so we certainly have resources to be able to kind of gather those information.
And can you tell us a little bit about some reasons that you might refer students to alternative mental health providers?
When we refer out, most often it's occurring when we see a need or the value of the student to engage in, let's say, ongoing therapy. If the student and I determine, hey, this is something that would be helpful, that ongoing therapy, talk therapy would be helpful, we can often support the patient in getting established with that. We also have, within kind of the spectrum of mental health or psychiatric services, some things that are called higher levels of care. For example, IOP, which stands for Intensive Outpatient Program. And the way I kind of just briefly just describing it, it's kind of like a part-time job. 3 hours a day, 3 days a week for maybe 6 to 8 weeks. Certainly that's not for everyone, yet it can be certainly a very helpful and supportive resource for students that really need it. That is also another reason why we may help support patients in referring off to another provider. But I also want to just emphasize that, here at, Student Health Counseling Services Psychiatry, we have the capability to see you from beginning to end. So you are eligible for our services when you become a registered student. So as long as you're registered with us, we are available here for you.
And you mentioned this just now briefly, but how long are your appointments and how often do they occur?
Intakes are an hour, and then follow-up appointments are 30 minutes. Frequency, really, again, that just is determined by collaborative treatment plan that we develop. It may mean a couple times a year. Sometimes it may mean monthly. It just all depends on really the student's need.
And what support does UC Davis Health particularly provide for low-income students who might struggle to gain access to psychiatric services?
Psychiatric services, the challenges of accessing are manifold, and one of the challenges certainly are financial. Here at UC Davis Student Health, what's available for students is something called Health Equity Fund. And now this is something that each registered student is entitled to. I think it's around the $2,500 range for your entire career as a student for here at UC Davis. You can access that fund for really anything health related, whether it's for appointments, particularly let's say if you are, underinsured, that fund is your entitlement and is available for you to utilize.
And right now, there are many changes that are being implemented within the Department of Psychiatry at UC Davis Health right now. How are these going to improve accessibility to mental health care for all students?
Over the past 2.5 years, really our intent has been to build up a service that offers accessible, compassionate, and evidence-based care. Compassion and evidence-based care certainly is kind of, that comes through hiring. And we've really been blessed to have a wonderful team of providers here. We have a team of psychiatrists, psychiatric nurse practitioners that continues to open up access to us. Between the fall of 2023 and the fall of 2024, there was actually a close to 40% year-over-year increase in volume demand for our services. Yet, through, again, leadership support, we've been able to hire to help support access to that demand. Here at UC Davis, we're really, really proud to say that at least data from just this past academic year, 2024-2025, shows that we average just about 18 days to access our service. We believe strongly that timely access is a critical part of addressing mental health. It's finding the help at the right time, the right kind of help to meet our students' needs.
And with that, is there anything else you'd like to add for students who might be thinking about accessing mental health resources?
If you're interested in accessing, we're here for you. You can ask for a referral, or you can go in and have a chat with your primary care provider or your counseling service, our partners over in counseling service, and they would be more than happy to support you in navigating towards us.
Perfect. Thank you so much for being here with us today.
It's a pleasure.
And this has been Aggies Talk Health podcast. My name is Varsha, and if you're interested in more information on our topic today, please visit the link in the description.